This is Everything Philadelphia, brought to you by Philadonian TV, sponsored by JoJoMacMusic.com. I am Pistol Buzz. Philadelphia pediatric hospitals are overwhelmed with sick children, most of whom have the contagious respiratory virus RSV. It's a trend that's happening across the country, complicated by the increasing number of flu cases. Doctors say it's time to take precautions to keep these respiratory illnesses from spreading more widely. RSV is currently the big troublemaker, potentially dangerous for young children, but adults can get it and can spread it as well. 16-month-old Connor Julian is among tens of thousands of children hospitalized with RSV. Connor's mom said, quote, he had a fever that was approaching 103 and Motrin and Tylenol wasn't making it any better. So as a parent, it's scary, end quote. St. Christopher's Hospital for Children is one of the region's hospitals packed with sick kids. Dr. James Reingold said, quote, we are definitely seeing an unprecedented type of surge, especially this early in the winter. We are definitely doing everything we can to try to think different and make as much room as possible, end quote. Reingold is the chief of the emergency department of St. Christopher's, where some units are being converted to accommodate a crush of new patients, including some coming from outside Baltimore. The entire Northeast region is overwhelmed and juggling patients. There's also ongoing staffing shortages, which are complicating the situation. Other locations overwhelmed with patients have declared health emergencies to get more resources and additional temporary staff. In 36 states, RSV cases are rising at alarming rates as a triple threat of viruses, COVID-19, influenza, and RSV, are filling hospitals to capacity. More than 72% of pediatric beds are full. All three respiratory viruses have common symptoms, often starting with a fever, congestion, and runny nose. Doctors say many children don't need to be taken to the emergency department. Parents are advised to call their pediatricians if their children have ordinary cold and flu symptoms, but if their child is having difficulty breathing, pulling in their chest, flared nostrils, or blue around their nose and mouth, they should seek medical care immediately. Some regions hard hit with RSV and other respiratory illnesses have made emergency declarations to get more resources. I am Pistol Buzz. That was Everything Philadelphia, brought to you by Philadonian TV, sponsored by JoJoMacMusic.com.
I'm gonna sing, yeah, you know.